One of the most dangerous cancers that are out there is pancreatic cancer. And the reason it's so dangerous is because the signs and symptoms are so subtle and so small that sometimes it can just creep up on you and cause issues. And by then, typically it's too late. In today's video, I want to talk to you about pancreatic cancer. We'll discuss what exactly is the pancreas. We'll talk about the causes of pancreatic cancer and some of the risk factors associated with that. Then we'll talk about the symptoms of pancreatic cancer, and then we will end on the treatment. And at the very end of the video, I'm going to give you 4 tips that you can do today to prevent your risk for developing pancreatic cancer if you or your loved one is at risk for developing this deadly cancer. This video is for you guys. Let's talk about it. Howdy y'all, Dr. Islam here, aka your poop guru, trying to give you the best tips and tricks so you can live your best life from the top all the way down to the bottom. If you haven't already, don't forget to smash that like button, like, share, and subscribe so you can get more videos like you're learning in today's video. Before we talk about pancreatic cancer, I want to tell you about a patient of mine named Brian. Now, Brian was a very active individual, but for the past couple months before he saw me, he started to notice that he had a lot of just upper GI issues and was not quite sure exactly what was going on. He had vague nausea and vomiting, a little bit of fullness, not a big deal. In fact, he really attributed this to nothing much and he really tended to ignore it. But he noticed that his symptoms got worse. He started to lose weight, get full quicker, and his clothes did not fit him anymore. So his wife got worried, and at the behest of his wife, he went to go see his PCP, who sent him over to me. And by the time we did imaging tests to find out what was going on, unfortunately it was too late. He had stage 4 pancreatic cancer. He had to undergo chemotherapy and or radiation. He's currently going through that treatment right now. And unfortunately, this ends up being a very common way that we diagnose pancreatic cancer because by the time you have symptoms, it typically is too late. So we'll start off with what exactly is the pancreas. The pancreas is an organ that sits right in the middle of your chest. Right in the middle of your chest. And the whole point of the pancreas is to produce digestive enzymes to break down fat. It actually does an excellent job of doing that. And in fact, sometimes if the pancreas doesn't work correctly or we are worried about pancreatic cancer, one of the more common symptoms is that you don't absorb fat. Now, some people can get inflammation of that pancreas called pancreatitis, but for most people, not a big deal. But there are certain individuals and risk factors that can make your pancreas mutate to develop in that cancer. So what exactly causes pancreatic cancer and what are the risk factors for that? Well, there's no one set cause that we know of that can lead you to have pancreatic cancer. We know it could be a constellation of multiple different causes and genetic risk factors as well. And we do know there are certain genes that are inherited that can make someone more likely to develop pancreatic cancer, which is why if you have a first-degree relative that has pancreatic cancer, mom, dad, brother, or sister, it is critically important that you get tested or get imaged of your pancreas. Now, here are some identifiable risk factors that we know can lead to develop pancreatic cancer. Number 1 is obesity. And unfortunately, the bigger you are, the biggest risk factor that you have for developing pancreatic cancer. Number 2, smoking cigarettes. Come on, guys, this is 2022. Don't smoke cigarettes. If you do this, this will substantially increase your risk of developing pancreatic cancer. Number 3, alcohol. And the combination of drinking alcohol and smoking can almost double or triple your risk for developing cancer. Number 4, chronic pancreatitis. This is when you have recurrent inflammation of that pancreas that over time can lead to scarring and can lead to pancreatic cancer. Now, these are all the risk factors that we can control to help minimize our risk for developing pancreatic cancer. But unfortunately, there are things that you can't control, but if you have, or you know somebody who does have, can increase your risk for developing pancreatic cancer. These include having a family history of pancreatic cancer, like I just mentioned before, having a condition called hereditary chronic pancreatitis, being older than 45 years old, being male, and being African American. Now, if you combine these non-changeable risk factors with the risk factors that you can change, and you have a high risk factor of things that you can change, that can substantially increase your risk for developing pancreatic cancer. Now, all things considered, the risk of developing pancreatic cancer is still pretty low, about 1 in 64. But if there is a risk factor that you can change and modify, especially if you have one of those risk factors that you can't change, this is the time and the reason to do that. I want to thank you for watching. If you haven't already, don't forget to smash that like button, comment down below. So what are the main symptoms of pancreatic cancer? Like I mentioned before, they are so subtle and so minimal that a lot of people blow them off. It could be something as simple as nausea and vomiting, or pain, or just some discomfort up in your upper GI area. And these are very non-specific symptoms because literally thousands of different things can cause these exact same symptoms, and the vast majority of them are not cancer. And this is why by the time they have real symptoms like weight loss, getting full quickly, having back pain, or your eyes or skin turning yellow, by that time, it is unfortunately too late. Other things include pale-colored stools, very dark urine, a sudden onset of diabetes, or if you've had diabetes before it was controlled, but now it's more difficult to control, itchy skin, or sudden blood clots. These are also, once again, very non-specific symptoms, but if you add these symptoms, plus all the risk factors that you have, that combination can make it more likely for you to have pancreatic cancer, or at least for you to be considered a high-risk individual that should get checked out to make sure everything's doing okay. So what are the treatments for pancreatic cancer? Well, it really just depends on the stage. If we are lucky enough to find it early and it's located in a good part of the pancreas, we can cut it out, get it done, and then you are cured. But unfortunately, the vast majority of people, by the time they have these symptoms, it's already spread. And by that time, you may need a combination of chemotherapy, radiation, plus or minus surgery, depending on the stage of that pancreatic cancer. So what are things that you can do today to minimize or eliminate your risk? Here are 4 things I recommend. Number 1, if you smoke, stop. By far, this is the biggest modifiable risk factor that's out there. Smoking just sucks. It's not good for anything, and it can substantially increase your risk for developing pancreatic cancer. Please stop smoking. Number 2, maintain a healthy weight. Obesity is a risk factor for all sorts of cancers, including pancreatic cancer. Have daily exercise, have lean foods, lots of vegetables, lots of fiber, lots of fruit. This is the key for decreasing your risk for developing pancreatic cancer and for maintaining weight loss. Number 3, eat whole foods. Have a wide colors of foods on your plate. Lots of different fruits, vegetables, and plants. Have as much diverse plants as you can. Minimize or eliminate processed foods. These good foods give you the nutrients so you can fight off these cancer cells and to make sure you're doing everything you can to decrease or eliminate your risk for developing pancreatic cancer. Number 4, speak to a doctor like me. Have us in the conversation. Allow us to determine what is the best side for you. What can we do together to minimize your risk? Do you need to be screened for pancreatic cancer? Do we need to do some genetic testing? Have that conversation with us. Allow us to do what we can to help minimize your risk. Here's what you need to do, my call to action to you. There are some things we can't change, like our sex and our age, but are things that you can change. Find one modifiable risk factor that I talked about, change it, make a change in your diet, make a change in your weight, stop smoking. If you do this, you're going to make steps to minimize and possibly eliminate pancreatic cancer in you and your loved ones. So my question today for you, what questions do you have about pancreatic cancer? Have you tried to implement these changes in your life? Comment down below. I would love to hear what you guys have to say. I want to thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my weekly newsletter where you get great tips and tricks like you're learning in today's video. And guys, don't forget, let's talk about poop.